This is the rule book, and as they stated earlier, you guys probably have a copy of it by now on thumb drive, but if not, you could go to the website and you can find a copy of it there. So if it is not allowed in this rule book, you must request a variance and submit HACCP plans before you conduct that process. So, and this must happen before you engage in any specialized process. It must be made in writing and approved. And it's not that we don't want you guys to conduct these processes in your establishment. It's just that you really have to know what you're doing when you're doing these processes. So to ensure that the adequate precautions are taken, the variance and the HACCP plans are required. And so what are specialized processes? These are methods used to extend the shelf life or preserve temperature control for safety foods by either reducing the amount of oxygen, using an additive, changing the water content, or preparing foods associated with special hazards. And some of these processes are sprouting seeds, juice, on-site processing and packaging, live molluscan shellfish tanks, custom processing of wild game animals, curing, drying, smoking for preservation, and reduced oxygen packaging. These processes are typically seen at the commercial manufacturing level, where they have really high-tech monitoring equipment that are designed to help in tracking and preventing these bacteria. The use of additives, as in the photo here, you can see like sushi rice and sushi. In this process, vinegar oftentimes is added, and it allows these business owners to hold the product at room temperature. They found that it's easier, and from a palate standpoint, for them to roll it and do things of that nature. In order for them to do so without the HACCP plan, they could just hold it for 4 hours, and all that's not consumed or used within that 4 hours, they can discard it. But when the new rules come out, written procedures prepared in advance must be submitted. They also must be maintained in the establishment and made available upon the request of the regulator. Fermentation. The main purpose of it is to lower the pH. That's how they control the bacteria that are present in these type of products. Kimchi, like you see here in the photo, is a type of product that's used for fermentation. There are other types of fermented foods. We all know about sausages, cheese, sauerkraut, yogurt, cider, chorizo, and products of these nature use fermentation. Sprouting seeds on site. Sprouting involves cleaning the seeds, disinfecting, and soaking to begin the sprouting process. Then they are collected. Not really getting into the type of bacteria. We could do a whole seminar on just the bacteria, such as an earlier presentation. But Salmonella and E. coli is commonly found on the ground, obviously, and that's how they get into seeds. And we really want you to understand the seriousness of these type of occurrences. So the variance in the HACCP plan is required prior to conducting this at your retail level. The juice processed and packaged on site. We actually see this quite often. HEB does it. They don't have to have the HACCP plan because they use the specific labeling. And on that labeling, it just says something like the product has not been pasteurized and therefore may contain harmful bacteria that can cause serious illness in children, elderly, and the immunocompromised. The live molluscan shellfish tank. HACCP plans are reviewed to ensure that the water is properly filtered and not mixed with any other aquatic species. Shellfish are received live and displayed in water tanks. Not to be confused with the lobster. That's not a live molluscan type of product. The next process we have is the custom processing. This is where, like if I were to go hunting and to kill a deer, if I wanted to have it processed to feed my family, then that's not necessarily a special process. It's when you want to conduct that process inside the retail establishment is when it becomes a special process. And the concern there is the animals that I would go out and kill don't necessarily go through a inspection process to make sure they don't have any harmful bacteria or parasites or any things of that nature. All of the food that's in the food chain is inspected at a higher level, like the FDA, the FSIS. They all have real stringent protocols on what can actually be sold. They do ante-mortem type of inspection. They inspect the animals to make sure they're not sickly and things like that before they're butchered and slaughtered and things of that nature. So that's why the custom processing is a specialized process at the retail level. Curing, drying. The curing rarely is seen at the retail level. I have been doing inspection for a long time, and I've yet to come across curing. Drying, however, you do see drying, and a lot of it is jerky. The jerky is a real popular special process that's conducted at the retail level, and that's fine as long as you submit the variance, you have the laboratory testing done to ensure that all of the steps are taken in order to prevent. The key controls for drying would be a validated process, obviously, the water activity below 0.88. That's something that you would get from a laboratory, the 0.88, which is why you have to have the variance in the HACCP plan. The approved source of the actual meat that you're drying. One story, I walked into a meat market, and a real popular meat at this particular market was a biltong. It's a South African type of dried meat, and didn't have a variance. I walked in, and he just had it like sitting there, hanging there, and it jumps out to us because we carried thermometers on our hips. So the first thing I go over and test it, and it's clearly, out of temperature. But here again, as long as you communicate with us and make us aware of what your intentions are, we can help you. So it's not that we don't want you to do it. It's just these type of processes present challenges in order to protect the public. Smoking. This oftentimes is actually confused with barbecuing, and that's not the type of smoking that we're talking about. We're talking about smoking for preservation. If you're smoking it just for flavor enhancement or color, that's not necessarily a specialized process. Reduced oxygen packaging is real popular. Business owners want to keep the color of their product. They want to reduce how much of it they're losing due to spoilage and things of that nature. You must submit the variance and submit a HACCP plan if you want to do that. There are ways to do it and not submit the HACCP plan or a variance. And in order to do that, you can only hold the food for about 48 hours at 41 or below, and it must be labeled with the production time and date and open and removed from the package in the establishment in order to do that. And due to the potential for hazardous conditions in low oxygen environments, this is why you have to submit a variance and have a HACCP plan approved prior to doing it. Controlled atmosphere packaging and modified atmosphere packaging is another type of ROP. In these type of packaging, you can see, I'm sure you open that package of jerky and you've seen that little oxygen scavenger in there. It just changes the composition of the air inside the package. Kind of helps preserve the preserve the product. The controlled atmosphere packaging is continuously control throughout the shelf life of the product by using a combination of total replacement of oxygen, impermeable package material, and using oxygen scavengers, as I just alluded to, or absorbents. The cook chill is common. We actually see this a lot. In this process, the restaurant owner or business owner, they have these airtight or impermeable bags, and they put a hot product inside these bags, a fully cooked product, then they seal it and they rapidly chill it, and then they store it. It just helps with efficiency, and when you're preparing food for large numbers, it just helps you be more efficient. The sous vide is a similar type process. We do see it in this process. It's similar. The only thing is it's actually raw or partially cooked product that's put into the bags, then cooked, and then rapidly chilled and stored. But they're both the same. It's just what your preference is there. Vacuum packaging, where air is removed from a package. That package is hermetically sealed, which is airtight, and a near perfect vacuum remains there. While I'm on vacuum packaging, fish, although we rarely see it, if you want to vacuum pack fish, it can only be vacuum packed if in the food establishment if it is frozen before, during, and after the packaging. And to talk about the HACCP plan itself, Mr. Rafael Morales.
Thank you, Ken. Is anybody here familiar with HACCP? Do you know what that means? You know, and do you have a HACCP plan in place? Now, is that a voluntary HACCP, or is it because you're doing a specialized process? You are correct. And in this case, we're not really focusing on HACCP plans for schools, which are a requirement because they have to ensure the consistency and quality of the product of the food that is given to the children, of course. Hazard analysis and critical control point plan. This is a plan, by definition, a systematic approach to identification, evaluation, and control of the food safety hazards. As Kendra mentioned, if you have a specialized process, we want you to have a HACCP plan. We want you to get it approved. There's certain parts to the HACCP plan that you have to submit to us, and we're going to go over that. But basically, we want you to know that HACCP is a tool, and it views the food service as a system, and it focuses on those factors that cause a foodborne illness. If you recall the slides that we just went through, each one of those processes has a pathogen of concern. A HACCP plan looks at the process and basically pinpoints, okay, what are we going to be addressing at this step or at that step? And it looks at the whole process, and it basically, as you will see, identifies those points where you can actually intervene and do something about it to either, and it tells you here, HACCP plan, written document based on HACCP principles, analyzes the hazards, determines critical control points in the food process, and develops procedures to determine if we are controlling those hazards. This is our variance request form. Of course, you can obtain this from your local investigator, your local inspector. If you have a specialized process, we have trained investigators, inspectors that can guide you through the process, get you the right paperwork to submit for a request. Most schools, if you have seen, are y'all in schools? I know that you are. For instance, as Mr. Wright was mentioning, if it's not in the TFER, if you want to have an exemption granted to you from those rules, you come to us. You let us know what exactly you want to do, how you want to do it, what are you going to do to basically circumvent those hazards and make sure that your food is still safe. In the schools, we have a perfect example. They don't really have the time or the manpower, or it's not really cost effective or feasible to have the labeling on every piece of food product that is packaged in the school and available for the kids to take and eat. So they request a variance. They let us know exactly how they're controlling for allergens, how they're keeping track of who is allergic to what, and how do they identify the students. So they give us the whole plan of how they basically are monitoring what the rule is set out to monitor. How are they doing it otherwise? Is it approved? So when they request an exemption from the labeling rules, we look through their process. Once we see that it's complete, it addresses everything, we're fine, we approve it, and they go about doing the packaging without the labeling. Why? Because their process is approved by us, and it addresses all the concerns we have. Now, we do have advantages of HACCP plans. Now, keep in mind that a HACCP plan can be a little tedious. It is a lot of work, but there are some quite good advantages to having a HACCP plan. Now, if you implement a HACCP plan, you will reduce product loss, you will increase your product quality, you have better control of the inventory, your food is going to be consistently good at that level, depending on your recipes and all that, of course, but you do have an increase in the consistency. You increase profits. Why? Because you are basically monitoring the process, how it goes, what is wasted, what is not wasted, and then you can address those issues to increase your profits. You also increase employee awareness simply because a HACCP plan will require you to do some training on your employees to follow that HACCP plan, to keep track of the process and all the steps. There are 7 HACCP principles. First, you conduct an analysis on the hazards. Where are the hazards? Find out what hazards are going to be in your process. And now, a HACCP plan is pretty much customized. It's not a one-size-fits-all. Because if you're doing, say, chicken soup, your recipe may call for other steps than as opposed to other places that do the same version of chicken soup. It's customized to look at your steps, not everybody else's. So you conduct a hazard analysis. You identify the critical control points. You establish critical limits, and we're going to go over these quickly. And it's pretty simple. You establish critical control point monitoring. You will establish corrective actions. We will see what those are. Verification procedures and also record-keeping procedures. So to conduct a hazard analysis, basically you are going to be looking at, as I mentioned earlier on the slides where we mentioned the specialized processes, each one of those processes has some pathogens of concern. So we are going to be looking at what can go wrong as well in the process. So in this case, when you look at it, the equipment, the methods, the people, everything, it's all together. Everything affects each other. You have to consider the procedures that you use to prepare the food, as I mentioned earlier. Your recipe may be similar to somebody else's, but the steps you take might be different. And you have to look at the whole process, from receiving to storage, prepping, serving, reheating, if that's the case, as the food enters and goes through your operation. Once you look at the hazards and see where those hazards can occur, then you can determine what measures you're going to be implementing to control those hazards. Now, keep in mind that the control measures are not exactly always meant to eliminate the hazard. Oftentimes, as long as they can reduce or prevent the hazard or eliminate it, that's fine. Now, this slide also mentions some control measures, such as proper hand washing, employee health policies, where you make it a rule that your employees are not to come to work if they have gastrointestinal symptoms, diarrhea, stomachache, you name it. And that you can go above and beyond. If you say, well, look, if you have a really bad cold, it's your rule, not TIFR, but you can say, look, it just doesn't look kosher. So let's come back to work when you feel better. But basically, when you have your policies to say you're going to be excluding these employees from working with food simply because they have a symptom that can be an example of a disease that can be transmitted through the food, then you want to exclude your employees. Another measure would be to check the temperature of the food that is delivered to you. So those simple steps you are taking, those are control measures in a HACCP plan, and it basically all comes together in a HACCP plan. Now, the principle number 2 is to identify the critical control points. Now, once you look at the process for your food, you might find that there are many steps where there may be a hazard or something can occur to contaminate the food or to make it unsafe. But you have to look at the whole process. Why? Because a critical control point is really an operational step where you can apply a control. If there's nothing you can do about it, then it's not going to be a critical control point. Now, but also keep in mind that there may be a step later on that is probably more important than the one previous to that. So if you have a hazard that's going to be eliminated in the next step, then the one before that, it's probably not going to be a critical control point. So not all steps are going to be critical control points. There's only a few, really, in each step of the process. Now, but do keep in mind that the intent is going to be to reduce, prevent, or eliminate those hazards. And let me give you an example. Let's say that in the process of your chicken soup, you get the chicken, you check the temperature, you store it, you prepare it. Obviously, someone's going to handle it at one point. So you might think, well, someone can contaminate that piece of chicken with their hands. But if you have the proper training and what we call the prerequisite programs in place, where your employee is trained to wash their hands every time it's required by law, or even more often, then that is already taken care of. So your critical control point is going to be the cooking of the chicken. And the rule requires that you cook that chicken at least to 165 degrees or higher for 15 seconds or longer. Establishing critical limits. Each critical control point, you have to put a boundary and to say, we cannot go below this. We can go above it, but we cannot go below this. So you have to set those limits, and you have to follow those. And all those have to be denoted in your HACCP plan. So when a critical limit is not met, food may not be safe. Now, critical limits are always measurable and observable. So if you cannot either measure it or observe it, then it's not going to be a critical limit. Procedures to monitor the critical control points. You have to make the observation, direct observation, to make sure that those critical control points are going to be kept under control. How? By sticking to those critical limits that you set forth. Corrective actions. Corrective actions are the heart of the HACCP plan. Why? Because if something goes wrong and the hazard is not addressed, then you want to have a plan on what to do. So your person in charge is going to have a plan in writing to say, okay, if that chicken's not cooked to 165 and the time of cooking has not been longer than X, then we can throw it back on the grill, put it back in the oven, whatever the case is, and we can finish cooking it. So you have to have a corrective action in writing to say what it is you're going to be doing. And if the time is unknown on how long that chicken's been out or whatnot, then your corrective action might be to discard that product. Okay? So also you have to establish verification procedures. That's a HACCP plan, HACCP principle number 6. Now, why do we need verification procedures? We need to make sure that your HACCP plan is addressing all the food safety concerns. We need to make sure that when you wrote it, you are addressing everything. And if you don't have a verification procedure, then you won't know whether it's working and if it's addressing everything you need to address. You have to keep records, of course, and we're going to talk about the record keeping. The verification procedure also allows you to see whether you need to modify or improve your HACCP plan because something may not be working or the records you're keeping may not be as accurate. So HACCP plan number 7 is establish a record-keeping system. Now you do have to keep a record, a copy of your approved HACCP plan on site at every location for which it is intended to be used. We will verify some records. We haven't established exactly how often, but whenever we have, say, a variance approved or a HACCP plan approved, we will go into your establishment and look at how well are you keeping those records. And the records should be maintained by the person in charge, should be available to the person in charge. And you should keep it as simple as possible, just to make it easy and for the employees to find and for them to keep up with those. We don't want you to have difficult to fill out logs and timesheets and that kind of thing. So the simpler the better, as long as it does give us an idea that you are looking at all the observations and you are keeping a copy of it. This is our HACCP submission form. Basically, we also denote on it these things. We want you to include in a HACCP submission form what your critical control points are, your critical limits, as we mentioned just now. Those are the principles. That's what we want to see on your HACCP plan. Your monitoring, who's monitoring what, when, how. Verification procedures, corrective actions, record-keeping procedures. We want your contact information. If your processes require lab results, for instance, Kendra had mentioned either biltong or beef jerky. If you have a process to make beef jerky, we want lab results to show that that water activity level is low enough to render that product as non-potentially hazardous or non-temperature controlled for safety food. If you are using labels, we want a sample of the labels, what it is you're including on there. And we also need a copy of any training programs that will address the specifics of your process. Now, I know that that's a lot of information, and believe me, we took a 3-day seminar on HACCP plans. So I wouldn't say we are experts, but we are well-versed, and we have resources to help you in case you decide to engage in a specialized process. But keep in mind, always run it by us. Use this as a tool. We are at your disposal to get information for you if we don't have it. But at this time, I'd like to I'd like to get some feedback and maybe hopefully get some questions from you.
I hate the alt tab. There we go.
Oh, was it?
That was it.
I'm sorry. Okay. Okay. So the first question is, okay, what items do I have to get tested to ensure harmful bacteria is not growing? Do I need to get my cooked sausage tested since I want to ROP it, raw sausage? Now, so I guess this is like a three-part question. So the cooked sausage, are we talking about doing reduced oxygen packaging? That would be my first question. Raw sausage, we would have to look at the ingredients, what goes into it. Oftentimes, ROPing raw meats are not considered to be a specialized process, so it really depends on the ingredients and what you plan to do with it, how you plan to store it.
Yes. Question about the cooked sausage being tested. No. As long as you follow the guidelines of keeping it at no longer than 48 hours at 41 degrees or below, and you open and remove that package while in the establishment, you do not have to get the testing there.
But we do have to have your procedures approved. I believe we have about 2 places that have the 48-hour exemption on the ROP, where they do cook chill as well.
Why can't fish be ROP? It's not that it can't be ROP. You can. It just must be frozen before, during, and after that ROP process. And you have to use a specific type of bag or vacuum packed bag when you do that ROP.
And and if you look at one of the concerns with fish is the parasites, and oftentimes the parasites can be destroyed by freezing at certain temperatures for a certain period of time. And that is one of the reasons why they don't want you, or the rules really don't allow you to ROP fish in at room temperature or anything above freezing. Okay, how does the HACCP plan relate to the new, now FSMA? Okay, so what exactly is FSMA?
The new Food Safety Management Act.
Food Safety Management Act.
This is still going to be implemented by the FDA, but we still don't know if that will replace HACCP.
Well, actually, the HACCP requirements haven't changed. I believe that the only thing that has changed is a 48-hour exemption. But beyond that, any specialized process has to be now. And the new rule, as far as the new TFR, the 2015 Texas Food Establishment Rules, addresses the need of a variance and a HACCP plan. Now, oftentimes a HACCP plan is not as complex as you might have seen in the industry. It can be as simple as just one process for one product, going from A to B, from B to C, and so on. but basically specifying what the process is, what is done at each step, and control measures. So it can be really simple. We hope to have some samples of HACCP plans in our website very soon as we have that website up and running, where you can actually see what parts we need. But it's to answer your questions, it is my, as far as my knowledge, it doesn't really relate to it, to the Food Safety Management Act, because and the only changes that we have seen as far as the seminar we've attended are the 48-hour exemption for ROP and the need of a variance and a HACCP plan for just about all specialized processes.
I just want to have, you had said that soon y'all would have copies of or some samples of HACCP plans. I just want to make a statement that you could go and Google right now HACCP plans, and you can see some examples of HACCP plans that are already in place for those that have never seen it. That's just general information.
You are correct, and actually the FDA has on their website a lot of guidance documents as far as HACCP plans, how to prepare one for your own establishment. We hope to have those links as well too, so it's not only our samples, we're going to try to link you up to other information.
Will all the slides be on a specific website so everyone can see them, know exactly what to do?
I believe that we have a copy of all the presentations, and I'm not sure that we do, and there's no one that I can ask right now. On the flash drive, I believe that we have a copy of each one of the presentations, so in case you missed one that you wanted to attend, you can still.
All right, we have time for one more question if someone has a question. Otherwise, we'll wrap up. No? All right. Well, thank you so much for presenting. I hope you guys have a good afternoon. We're going to be meeting back in the main room for our wrap-up session.